Hello, hi, thank you for joining me. This is Dr. Erica. I am a pharmacist for close to 10 years now, and this is my platform, YouTube. Also, visit my website as well. And please hit that subscribe button that you see in the corner. And please feel free to binge watch on all my videos. Thank you for joining me. This particular video, I'm going to talk about blood pressure for healthy patients and patients who are diabetic and so forth. So the criteria are a little bit different just because healthy patients who are otherwise healthy based upon age should receive a certain blood pressure range. And that would be 140 over 90, a systolic of 140, diastolic of 90 for someone who is younger than 60. And also someone who is 60 and greater should also have a blood pressure of 140 over 90. But if the patient is due to have diabetes or due to have a cardiovascular disease, then the patient should have a blood pressure goal of 150 over 90. Someone who is 80 years of age, we want to be less strict on their particular blood pressure, because as we get older, our blood vessels, they weaken, our heart weakens, the muscles, the smooth muscles that line those particular arteries and veins, they become weaker and cannot control the blood pressure as much. So we want to do a blood pressure of 150 over 90 for those patients who are 80 years of age and older. Now, those patients who have a diabetes or kidney disease, we want to do a blood pressure of less than 140 over 90 for better control of the heart, and also we want to decrease risk of morbidity and also mortality. Okay, so we want a goal of less than 140 over 90. The systolic is more important than the diastolic. So the systolic, again, is when the heart is contracting, it's pushing blood out of the heart and into the veins and into the artery. And then the diastolic is going to be the resting. It's going to be when the heart is resting and filling with liquids. And also, we want to make sure that we are having a healthy heart with less fluid on the heart, things like that, less strain, less wear and tear on the heart by exercising and proper dieting. Also, we want to make sure that if we're developing signs and symptoms of weakness or signs and symptoms where we cannot function properly, do our daily tasks, let your doctor know. If you're having shortness of breath, for example, while doing your daily activities, that's a sign of heart failure. Okay, so do be aware of that. So patients who have tried exercising and dieting and still don't have a control good blood pressure, then doctors will start a medication, usually a beta blocker or an ACE inhibitor or an ARB, to initiate therapy for better rate and control of the heart, and also to control hypertension. Okay, so it only depends upon not only age, but also the patient uh, weight, and also their, again, exercising and dieting outcomes. So do be aware of that. All right, so that's all I have for this particular video, just to give some information on healthy blood pressure goal and those who are dealing with comorbidities such as diabetes and cardiovascular disease. So thank you for joining me. I'm Dr. Erica. Have a great day. Bye-bye.